Hi everyone, welcome back to my channel. Nurse Katherine here. Today we will be trying something new. We will be going through a case study. Case studies can be very beneficial in nursing and in nursing school, but most importantly, case studies will be on the new style NCLEX coming out in April of 2023. My goal is to always help you all be the best nurse you can possibly be and help you learn in new and creative ways. I've recently partnered with NCLEX Mastery to offer you all 10% off the NCLEX Mastery monthly subscription. This is a great app and website for you to use while in school and while preparing for NCLEX. I actually used this website, it was a website then, when I was in nursing school. I don't think they had the app quite yet. They have over 1.5 million users and have over 3,000 questions based off of past exams. So if I were you, I would take this opportunity. You can find a link in the description below. But other than that, let's get into today's case study. I will start with reading today's case study, and then we will go through nursing interventions, patho, and skills that you will need to know and how to make your way through this scenario. There is no question bank at the end of this. I am not testing you. I'm simply just helping you to start thinking like a nurse. So here's the scenario. You're working in the ER as a registered nurse. You are assigned a 36-year-old female with severe abdominal pain. What do you do next? This is how nursing is in the ER. This is all the information you will be given, and you yourself need to gather all the rest of the information. So what do you do next? Let's go step by step in what you need to do to gather more information and adequately treat this patient of yours. Step 1 is to gather more information. You are going to use the acronym PQRST. Anytime a patient of yours is in pain, you want to use this acronym. We are going to go through this acronym and gather more information on our patient. Starting with P, provocation. Ask, what were you doing when this pain started and what makes it better or worse? Your patient reports she was watching TV and reports she has not taken any medication for the pain and does not know what makes it worse. Next, you move on to quality or quantity. Ask, what does the pain feel like? Does it feel dull, sharp, aching, or twisting? Your patient reports it's a sharp pain. So we now know she was watching TV and suddenly experienced a left-sided abdominal pain. Move on to R. R stands for region. We already know this is left-sided, but ask, is this your upper or lower stomach? You want to be as descriptive as possible for your charting and for the attending seeing her. She reports it is left lower quadrant pain. Move on to S, that is severity. Ask, on a scale of 0 to 10, 10 being the worst pain you could imagine, what is your pain level? She reports it's a 9.5. Then move on to T, timing. Ask, what time did this start? What time did it stop? Has it ever happened before? And so on. She reports it started about an hour ago. So just from using PQRST, we have gathered that we have a 36-year-old female with left lower quadrant 9.5 out of 10 pain, started about an hour ago while watching TV, and it has not gone away since. The abdomen houses so many organs, and there could be a multitude of different reasons why our patient is having left lower quadrant pain. As a nurse, we cannot diagnose, but we can critically think and make a hypothesis about what may be going on in our patients. What are a few diagnoses that you think may be going on? Let's continue on to step 2. The following blood work has been placed due to using your nursing protocol orders. You selected abdominal pain protocol. The following is entered: a CBC, complete blood count, AST and ALT, which are your liver function tests, your creatinine level, kidney function test, a BMP, a basic metabolic panel, a urinalysis, and a pregnancy test. The patient explains to you then that she had her fallopian tubes tied, that she cannot be pregnant, so why would she need to be taking a pregnancy test? You then go on to explain that it is protocol for any woman of childbearing age to take a pregnancy test when they come in with abdominal pain. So she gives you her urine sample and you run the pregnancy test. Well, it comes out positive. What do you do next? The urine pregnancy test came out positive. Well, with further tests and studies, you find out the patient is experiencing an ectopic pregnancy. The patient then asks you, will the baby be okay? Is my baby going to be okay? You just shared that she had a positive pregnancy test. This is a real situation that you may be in one day. What will you say? In ectopic pregnancies, the fertilized egg at the stage of a zygote is implanted in the fallopian tube. Ectopic pregnancies are non-viable pregnancies, and your patient will now need to go into surgery to remove her fallopian tube. Ectopic pregnancies can be emergent and can cause a fallopian tube to rupture. You explain just that to your patient. You explain that the baby cannot develop inside the fallopian tube, that the baby cannot develop outside the womb. But then she goes on to ask what caused this. And as a nurse, that is your job. You are to educate your patient. So what did cause this? You then go on to explain some of the causes of ectopic pregnancies. Some causes may include hormonal factors, STDs, damaged fallopian tubes, fertility treatments, and smoking. Shortly after that, your patient is then whisked away to surgery and you have your new patients coming. Now, there is so much more that you would have done for this patient, but to keep this case study short and sweet, we focused on the PQRST and education. That is a big factor in nursing. Getting more information about a scenario and then educating your patients also. This is a true story that actually happened to me when I was in the emergency room. Now, I did change a few things in this story here and there, but this actually happened to a patient of mine when I was in the ER. Today's video was to help you start thinking through the processes of nursing, help you thinking through those critical skills, gathering information and educating, as those are things that we are to do every single day when we are on the floor in nursing. But other than that, that is it for today's video, everyone. Thank you for tuning in. I hope you learned something from today's video. Make sure you like this video, subscribe, and hit the notification bell. Other than that, that is it, and I'll see you in the next video. See ya!